Welcome to the Strength Coach Collective, a podcast brought to you by Two Brain Business. We are here to help advance the strength and conditioning coaching community by bringing you a wide range of experts in the field. You can join our group at strengthcoachcollective.com. For today's episode, I'm your host, Kenny Markwardt. And today I'm joined by Derek Batman, who is the owner of Hardbat Athletics in Newark, Delaware. With a lifelong dedication to fitness, Derek studied exercise science at Indiana University of Pennsylvania and Westchester University. For over 13 years, he's been leading Hardbat Athletics, helping the Newark community become stronger, healthier, and more resilient. Derek's coached national and pro-level athletes in CrossFit, Olympic weightlifting, powerlifting, and mixed martial arts. His vision is to make fitness a non-negotiable part of life for 5,000 people in Newark. Welcome. Excited to have you, man.
Thanks, Kenny. I'm excited to jam with you.
Yeah, me too. I love all of our conversations. I feel like should be recorded when we get going on training. And I think we both just have a massive passion for continuing to refine the process and make things better and explore different things. But what I want to chat about today is onboarding and assessments and screens, because I know you've gone pretty deep in that. And it sounds like you've seen some massive results for your clients and results for your coaches in terms of understanding what they need to be doing with their clients. And I think it'd be just really great to get everybody doing the same thing. So you want to just start with like how you do that? I mean, take it for where you want. Let's just go.
Yeah. So I think it's important to just address why this came about in the first place for me. And just looking back and being honest, like I think it was very much an ego check as a gym owner, in just spending enough time inside of my gym and being like, okay, like there's definitely some high quality movement and progress going on here, but there was enough cringe moments where I was watching people do things that were probably outside of the scope of what they should have been doing. And realizing that we had a very limited or non-existent like screening process for new people coming into the gym to help my coaches make better decisions around exercise selection and programming protocols and those sort of things. And then that was paired with the fact that I was finding the same thing whenever I would travel and drop into gyms was just this, like, there was a cohort of people that had generally moved fairly athletic and were mobile and stable and like generally coordinated. And then there was this cohort of people that were not, and they were being underserved. So the start of this was me figuring out a way to both standardize and create some prerequisites for movement inside of the classes. And for that case, we chose level method. And then it was, how do we get more data and information on the members or people as they are coming through our doors so that we can make more informed decisions about how to get them started.
Yeah, I love it. I'm embarrassed to say that I've had so many of those same moments. I can actually remember some of them in my mind where I was like, what are we doing? Like, why are we doing this? Why is that person doing this? This is horrible. This is not serving them. And it would tend to lead me to make sweeping decisions rather than focus on the individual themselves and make, a process that would assign, allow us to assign better program design, even if it's within the groups for those people. Yeah. Rather than like, okay, we're never snatching again because it doesn't make sense for these people. You know what I mean? Like those are the kind of things where I'd be looking around and be like, what in the heck is going on? And then people will be upset because, oh, we're not doing this because I don't feel as responsible. But really it was just trying to like address the individual and making decisions according to the group, which was underserving people. So anyways, yeah, totally on board with you.
Yeah. And with that said, I think it's important for us as gym owners, but also for coaches to give themselves some grace. This is a very like bootstrapped profession. And people are very passionate about it. But there's 1,000 ways to skin the cat with this. And there's a lot of different methodologies and a lot of different information out there about how you should go about training clients. And while people's hearts, I believe, are 99.9% of the time in the right place, I still think it's important that we give ourselves some grace and that, like, you mentioned this to start the podcast, like we have grown, evolved, and continued to learn. And we're both 15 plus years in, and we're still on that journey of continuing to evolve and learn. So what I don't want this to be is like a conversation that makes people feel either like shameful or like they're doing something wrong with their clientele just because they're not using screenings yet.
Yeah, totally. No, that's a really good point. And I think the point is just continuing to try and evolve and make better decisions. And that, I think it was Greg Everett this always stuck with me. We said, if you don't look back a year of what you were doing a year ago and laugh, like you're not progressing. So you're always going to feel stupid at some point looking backwards at what you were doing, as long as you're moving forward in the positive direction. So
Yeah,
what did,
it's go ahead.
yeah, go ahead. Nope.
I was going to
You're
say
up.
it's funny you say that because we do coaching development at my gym with my coaches every like 2 weeks, and I find myself every couple months being like, hey, like remember when I told you this? Like I've actually kind of changed my mind on that. So
Yeah.
while there are definitely some principles that are tried and true and are always going to stay put, like there are definitely things that we change our minds on pretty frequently, and there's no shame in that.
No, for sure. I agree. So what we're talking about here is like you do have an onboarding. I think most gyms now, regardless of their whatever they're doing, they are doing some sort of an onboarding. But you're doing more like movement screening. You're doing it to a more specific degree. So can you outline what that process looks like?
Yeah. So we kind of go through three phases. The first is we do a table screening, which I'll expand on more here in a second. We do FMS screening, which is a standardized form of screening called the functional movement screening. And we don't use all of the tests that they use as part of that screening, but we use some of like the ones that we feel are the best fit for our clientele. And we'll also kind of pick and choose depending on the individual and their level of fitness coming in. And then we do some form of assessments, which is really just like baseline testing. Most gyms and coaches are doing this or should be doing this no matter what, even if
Yeah.
you're not doing a form of screening, as a way to kind of get a baseline for just general fitness based on the person's goals and their starting point. I think the very first thing I want to address, because we talked about how we've both had some cringe moments where you're watching people move or doing choosing certain exercises that maybe have been given to them. And look, to be fair, sometimes you have egoic people, and it's like you can give them all the instruction in the world, and they're still going to choose to do something that you recommended against them or for them. That's going to happen. But we've acknowledged that sometimes that people are doing things that they shouldn't. The goal of a movement screening is not to restrict movement. It's having a better idea of where should I start.
Yeah.
Does that make
Totally.
sense?
Oh
So
yeah, for sure.
yeah. So, and I wanted to make sure I address that because what often happens is I bring up screenings with coaches or gym owners, and they immediately think like, oh God, like I'm just going to be having to tell all my members, like, guess what you can't do anymore. And there's two big things with that. One, people never get tired of results. And if you change what someone's doing in the short term and in the long term, it benefits them by the way of being pain-free and being able to have better movement and being able to produce better power and feeling more stable and more comfortable and strong, X, Y, and Z, they're going to love it. And then simultaneously, with new people coming in, it gives them a sense of this is meant for me right now. And it's something that I can do and see progress in rather short order, rather than giving them a task that's too tall for them and making them feel discouraged.
Yeah, totally. And I think that's a beef that I've had with this industry, or just in general as a continue. Like I feel like as exercise professionals, we don't get the respect that I wish that we did. And because I think there's been a long-standing culture of trial, like people just jump in and out of things. And I don't think that we take the stand as professionals that we should. And I think a movement screen puts us more on that continuum. And by that, I mean, like, it's, and touching on what you just said too, like where people feel like you're disciplining them. I think that by having screening and having onboarding and developing a culture of coaching and developing a culture of like, hey, this is why you shouldn't be doing this. Here's how to improvement. Here's how to, for lack of a better word, earn the capability of doing this for your overall long-term health and wellness. Like I think that having the confidence to do that and building a culture around what you're doing in there levels up that level of respect and candor that people will have to further buy into what it is that you're doing for them for the long term. And if so, anyways, I'm 100% on board, and I think that what you're talking about doing is is like an onboarding or an on-ramp that, like in most gyms are doing, but taking it a little bit further rather than understanding these things under load or under intensity or whatever else. So you're getting it, even before then, which I think will just further help the thing. And you're not talking about. So I'm familiar with the FMS. I've done that certification, but for those who haven't, it's like a 10-minute, if that, test. Like it's really brief and really meant to be done pretty quickly and pretty efficiently.
Yeah. So just to piggyback on your point really quick, one of the things I tell my coaches about the necessity for these things is that there are hotbeds all over the place for them to get more clients. And some of them are physical therapy offices, doctors' offices, and the bridge between them getting those clients and not getting those clients is built on skill set and knowledge.
Mm-hmm.
Like the more that the doctor or the physical therapist believes that you are in good hands and you have enough knowledge and willingness to know what is out of your scope of practice versus what is in, and how to handle some of the basics like tendinopathies and those sort of things, they'll place greater trust in you to work with their clients.
Totally. Yeah, I believe very strongly that we're all in the same continuum. And I think that's probably pretty obvious when you look at it, but I don't think that that's very well understood or respected by the practitioners, like the physical therapists or orthopedic surgeons. But the more you can have those kinds of conversations and get as close to bridging that gap as you can, where if somebody's coming out of physical therapy, again, I'm not a physical therapist. I will never be a physical therapist. But if I can have that conversation with them where I'm looking at a movement screen and then appropriately assigning movement patterns and exercise to people, those physical therapists are going to be very comfortable referring clients to you, and then continuing that continuum with that client who should be restored to full health and wellness, right?
Yeah, well, and if you think about it, let's say you injure your knee and you go to your physical therapist. If they're a good physical therapist, the very first thing they're doing is not just like, okay, let's just look at the knee. No, no, no. They're going to get a snapshot of your entire body because they know that there are things that are both distal and proximal to that knee joint, which could implicate your symptoms, whether it was a cause of the pain or it was some sort of like chronic mobility limitation that like over time wore away and led to this particular injury. So the point being is like they're using a form of a screening process, albeit more rigorous and more more difficult. They're using one for information purposes for their for what they do. So I think just by implementing one, even if it is very simplistic and basic, it earns the respect of people that are already doing this.
Yeah, totally. So you mentioned the table screening. Is that kind of the first step for everybody?
That's the first thing. And I think this serves two purposes for us. The first is that it's very passive and easy. In the way that you don't want to bring a client in and be like, okay, like it's very nice to meet you. We're excited to get started. We're going to max your back squat out right now. You want to kind of soften the blow, if you will, and kind of like gradually build them into it. The table screening is a great opportunity because you're both in this like semi-seated position, right? Like they're seated on the table. Usually like I'll sit on a box or something where we're at the same level, and I let them know what we're about to go through. So I think it's a really soft opening that it just is very welcoming. And it also doesn't require a ton of effort on their part. So we go through a few things as it relates to the table screening. So we look at hip flexion, we look at hip internal rotation, hip external rotation. When it comes to hip flexion, we're going to look at it both passively and actively. And all this means is that hip flexion is the ability to flex at the hip, or to basically, if you're standing tall and you were to raise your right leg as high as you could while with it straight, we're looking at, if they're lying on the table, how does the ankle bone, where does it fall in comparison to the other leg? So is their ankle bone below the kneecap? Is it between the kneecap and the upper thigh? Or is it like at the hip or above? And based on that, we can kind of give them a ranking. For us, we say either normal, limited 1, or limited 2. Normal being the ankle bone exceeds the hip line of the hip. Limited 1 is in between the hip and the knee, and then limited 2 is beyond the knee. And then we look at this passively and actively. And what I mean by that is active being they are going to work themselves through that range. So they're going to use their abdominal muscles and their hip flexors to pull them as far as they possibly can. And then what I'm going to do is, while pressing down the opposite leg that's on the table, I'm going to push them even further. Obviously looking for either grimacing on the face or asking them if they're experiencing any pain. And I'm going to push to a point where I'm getting like pretty good solid resistance and see, is there a disparity between their active range of motion and their passive range?
They're laying for this, correct?
They are lying. Yeah, that's correct.
Okay.
So they're lying on the table for this test. The whole body's on the table.
Cool.
Yeah. And from there, we also look at shoulder flexion. We do the same thing, passive and active test. The arm is straight. We lock the rib cage down so that the spine and rib cage are flat on the table. And we have them raise their arm as far as they can over their head with the palm facing towards the body. They're in external rotation, elbow locked out, and we see how far they can get. And there are, same thing with the shoulder here. There are normal ranges and then limited 1, limited 2 that we're looking for. I think for all intents and purposes, the biggest thing is you're trying to see through active range of motion, how far can this person get overhead? Is there any pain associated with that movement? And then if I try to take them further by pressing them into that position, A, can they get there? And B, is there any pain associated with that range of motion?
Awesome.
Yeah. So we look at shoulder, ER, and IR. So external rotation, internal rotation. And then we look at shoulder abduction, which is essentially when they're lying on their back, rib cage glued to the table. If you have them bring their arm to their hip and then do essentially like a half moon and go all the way overhead. And we look at that range of motion as well.
So is that 5 tests and comprising those 2 positions, more or less?
It's give or take. Yeah. I mean, I would say it's probably closer to 7. And then the final one is dorsiflexion. So this one's really simple. We have them usually start with 3 fingers from the wall. They place their foot on the ground behind those 3 fingers in a half kneeling position, lean towards the wall. And we're looking at, can they maintain their arch? So we'll often do this with their shoe off. Just for a more accurate test, because obviously shoes have different heel heights and slopes and so forth. And also you can see more clearly if they're collapsing the arch in order to gain range of motion. Mm-hmm. We'll have them drive their knee without shifting their hips around, keeping their hips squared up towards the wall, and see if they can make contact. If they can with 3, we'll go to 4 fingers. If they can with 4, we'll go to 5. And then we look for disparities side to side.
Cool. Awesome. So again, I think just trying to summarize, you'll have then at that point 8 scores. So you'll have 8 scores out of 3.
Yeah. So we'll talk a little bit about scoring when we get to the FMS, but as far as like what we're looking for here is all of these notes get put into, for us, we use TrueCoach, but they get put into the info box for this person so that we have a date and the established test that we're looking at. Cool. The only time that we will outsource is if somebody is experiencing things like neuropathy or a severe lack of stability in certain positions or extreme pain. So if you have somebody, let's say, go through their shoulder screening and they're experiencing like a greater than like a 5 or 6 out of 10 on the pain scale, it's like, okay, like you may very well have something going on here that's out of our scope of practice. Yeah.
Do you have a good relationship with somebody you refer out to?
We do. So we have 2 physical therapists that are local to us that we have great relationships with. They're both awesome. The only difference is one takes insurance, the other one doesn't. One is a little bit more on the athletic side, and the other one's a little bit more general pop. So depending on the fit, we'll send them to either one.
Yeah, that's awesome. Again, I think on that continuum conversation, that's so important to have that. And again, to have an educated conversation with those people who will then understand that they can comfortably refer people to you. And again, it's a back and forth thing where people will not always be in one area on that continuum and they may go back and forth, but to have a pretty linear set of professionals who can assist them wherever they fall. That's so amazing.
Yeah, for sure. And one thing that comes with that too is that you learn so much from those individuals. And most physical therapists want to they don't want to work with people forever. Like they
Right.
want to work with someone, get them back to a baseline or standard that person needs in order to meet the demands of their life or sport or what have you. And then they want to pass them back off. And if they can hand them off and give you instruction and you know enough to be able to kind of take that information and apply it in your programming with that person, like it's all the better for everyone around.
Yeah, totally. And then that an exercise professional who is capable to do or to help them with their homework. Like, I don't know how many surgeries you've had, or, but I know when I had surgery on my shoulder, like I was given homework. Like I graduated from physical therapy because it wasn't, didn't make sense. Like financially,
Yeah.
I think I ran out of insurance or whatever it was. And they're like, you can do this on your own. Guess what I did? None of it. I didn't do any of it. Like I think that's so much of what we provide as exercise professionals is accountability. And I think that that's a very common example. And I've talked to so many people who come into the gym and they're like, yeah, I stopped doing my physical therapy as soon as I stopped having my appointments. But the point is that when that physical therapy professional knows that they can refer to you, who can make that a part of their program, and that person is now graduating to fitness, but they can continue doing their homework while they're also doing more, fitness based things. I think that's just, again, in the terms of the continuum thing, I think that's just so valuable.
Yeah, and anyone who's been through physical therapy for an injury or something to that nature can remember they probably were given exercises that they thought were going to be super simple, and when they
Yeah.
were in the presence of their physical therapist, they were really freaking hard.
Yep.
And I
Totally.
think the takeaway here is that when you apply a high degree of intention and understanding of like the stimulus that you're trying to generate with a specific exercise, even though it may be seemingly easy or kind of trivial compared to going for a heavy back squat or doing some sort of complex movement like a snatch, if you have someone with you forcing you to do it correctly, it is incredibly challenging.
Yes, for sure. Yeah, the virtuosity of some of those things where you can do them intent and with appropriately is just, yeah, it's way, way, way harder.
Yeah, and when you build that knowledge as a coach to be able to be kind of the to be the continued education, if you will, for
Mm-hmm.
that client who just finished physical therapy. It speaks volumes to them, and I think it's easier to keep them engaged with things that may seem boring on surface. Like a good example of this is like 90-90 breathing. It's one of those things where like you watch someone do it and you're like, that looks like the most boring thing in the world, and I don't
Yep.
understand why you're doing that. But when you do it and you have someone forcing you to like really, really like compress the rib cage and keep your abs turned on and be able to breathe in that position all while your hamstrings are turned on, you're like, holy crap, like this is way harder than I thought it would be.
100%. Yeah, agreed. Okay, so we left off on the table screening,
Yeah.
and the dorsiflexion test is the next step. The FMS or the examples from the FMS that are appropriate.
Yeah.
You find
So
appropriate.
the next step is we move them into the FMS screening. And this is where, again, like we started with something a little bit more passive and now we can move them into something that requires them. It's going to bring a little bit more challenge. So the first test is a deep squat. And it looks like an overhead squat. So they're holding a PVC pipe or a dowel, as they call it. And we're looking, can they go into a full depth squat while holding this overhead? And this evaluates like the mobility of the hips, knees, and ankles, the thoracic spine extension, core stability, and control. As you would imagine, most people performing this test cannot do it at bare minimum without their heels elevated. We use it's like a small board in order to elevate their heels. But this is a really good indicator of like just overall mobility and coordination to kick things off.
Yeah, is it? I mean, it's they. I have the FMS tool, but it's basically supposed to be a 2x4, from what I remember.
I don't think it's a 2x4. It's thinner than that,
Okay.
but it's still a good lift. I want to say it's like a 1/2 inch board.
Okay, but yeah, the point is like you can go to Home Depot and grab the tools for this. I think what I'd like to conclude with, and I don't want to go there now, but like what people can do to educate themselves on how to do these things, and what they're going to find is, again, the simplicity of it and the availability of being able to do it very, very easily. So again,
Yeah, and
when you said
just to
elevating
show
heels, that's
a
what
way
it
that
is.
you can kind of extract something from this test right out of the gate is like if you have an individual and you have them try this without the board first, and
Mm-hmm.
they can barely do a quarter squat, their arms are bending, they look incredibly uncomfortable, and you put the board there, and all of a sudden they're like at parallel or below, and their arms are straight, and it's like, okay, like now you have some information that you immediately can put into practice when they start, whether it be in classes or with you one on one.
Yeah, totally, 100%. Okay, so overhead squat, and then what's your
So
next test?
then we move into a hurdle step.
Mm-hmm.
So the basics of this is they hold a PVC on their back, which is really just to help stabilize, and you can see really easily if they're shifting to the right or
Mm-hmm.
left in order to perform this. And then there's we use like a band that we stretch over the over a squat rack, like over the J cups, and they step over this 1 foot at a time, and they tap their heel in front of it and then bring it back. One of those tests that, you know, from the outside looking in, if you have even a moderate amount of athleticism, you're like, that looks pretty darn easy. You would be very surprised how many people have to do some sort of like weird shifting in order to get
Mm-hmm.
over this. Um, Now, interestingly, this is where you start to kind of pair the knowledge you gain from the table screening to these movements, because you're able to see in real time. Like a good example of this is like, let's say that the individual lacked hip flexion when you had them on the table. So they were like limited to an hip flexion. You will generally see that they'll have to do some sort of compensating when they're stepping over the band. They'll either internal or externally rotate at the hip in order to make room or gain mobility to get over it. So this is where it's cool, because you start to see the stuff that you learned on the table like rear its head in actual movement.
Totally. Yeah. Which again, just to kind of like reassert the importance of it is like that these movement patterns before going loaded, like doing them unloaded is an assessment, but to do them loaded could be seriously detrimental with, and you'll never have any idea without doing this stuff, right? Like, I mean, just hypothetically, a front loaded forward lunge or something, like to do that loaded and have that movement pattern deficiency, like that could be pretty detrimental depending on how they're having to compensate for their inadequacies. Like, and so to know this on the front end, like that's super, I get that's massively important in my opinion, in your
Yeah,
opinion, I
and a
should
way
say.
you could see real life application here with this particular screen is imagine you have somebody that is having to contort their hip in a certain way where their tibia is not lining up with the foot correctly, and their their knee isn't lining well up with the hip, and now this is how they go about stepping up anything on an incline. And now
Yep.
imagine this person's climbing stairs, or God forbid going on a hike, and you have this repetitive kind of blow to the knee or hip joint or an ankle over and over and over again. You can see how somebody like this could develop knee issues by just repetitive walking or
Yep.
stepping.
Yeah, for sure. Okay,
um,
so sorry, go ahead.
Yeah, so I was going to say, then from there we go into what's called the inline lunge. This is where they stand on the board, and I'm not going to get into like exact foot placement and whatnot, but they stand on the board. There's foot placements that are situated on the board, and they go into a lunge with the PVC on their back once again, so you can see any sort of shifting. They're going to tap the back knee to the board and then stand. The challenging thing here is the feet are perfectly in line with one another. So there
Mm-hmm.
is a balancing component to this. And with this, we're looking at, again, ankle, knee, and hip mobility, core stability in a split stance, and then balance and coordination. What you're looking for is if they lean forward with the trunk, or a loss of the dowel or PVC alignment, restricted ankle dorsiflexion in that front foot, poor hip and knee control, and then balance and stability.
Also, yeah, again, there's a lot to go down that road with like the importance of it, but for the
Yeah, and as
interest of
we
brevity.
talk about, once we get into like some of the assessments, like you can see how this would implicate something like a split test, or I'm sorry, a split squat
Yep.
assessment following this.
Yeah.
And this is already giving you good ammo as far as like, is this person going to even be a good candidate to test split squats with?
Right.
Because you have people that get nowhere near touching the board without the heel coming up or without losing balance. Sometimes you'll have somebody who has like decent coordination and balance and strength on the right side, but the minute they switch, it's terrible. So it also gives you a sense of disparity.
Yeah. Yeah. Okay, what's next?
The fourth one's really simple. It's the shoulder mobility test. Everyone's done this at some point. This is where they're basically putting an arm over top of them, and then they're reaching the other arm behind them. So you're looking at both shoulder extension and shoulder internal and external rotation, respective to the top and bottom shoulders. And then they try this on both sides, and you're essentially measuring the distance between the fists on the upper hand and the lower hand when they're trying to touch their hands together behind their back.
And these are all on a score of 0 to 3, correct?
Yeah, these are on a score of 0 to 3. I don't want to get into the whole scoring system as it relates to this, but again, what's important to note here is that you're just understanding, you're gathering as much information on this person as possible, so that as you get into the assessment phase and then program design, you have information to kind of make some decisions.
Yeah, I think it's just simple, right? We're not getting goniometers out and doing all sorts of math. Like, it's not that complicated and very efficient. And to base it off of a 0 to 3 is something that, again, you don't have to be massively educated in which to do this. It's pretty simple.
Yeah.
So, okay, what's after the scratch test? What's next?
So they typically do, this is where they actually look at the active straight leg raise, which is what we talked about on the table screening. So we bypass that one because it's the same thing. But then they go into the trunk stability test. This is where they're going to essentially perform a push-up. Now, the hands are aligned a little bit higher than normal. So they're at the forehead for men and chin for women. And the goal is that they want to keep their body straight and be able to do a full press up into this like plank-like position. What's cool here is that because you're raising the hands, you get a much greater understanding of just general shoulder girdle strength and stability than you would get as if the hands were closer to like a normal push-up position or even lower for some people if they're trying to like cheat the movement. And then you also get an assessment for like their core strength and stability. As you would imagine, it's the issues you're going to see here are going to look very similar to having anyone try a push-up. Like, you're going to have a breakdown in core stability. You're going to have a lack of upper body pressing strength. So everyone knows what the inefficiencies look like here.
Yeah. And there's one more, right?
Yeah. So then we go into rotary stability. So this looks similar to a bird dog. The fundamental difference here is that it is actually the same side that's moving. This is one of those screenings where like I can't tell you how many athletes have failed this.
Oh man, me. I was like, I'm reading this wrong. This is impossible. There's no way this is the actual test. This is way too hard. I can't, like, if I can't do it, it's wrong. I was definitely that guy.
Yeah. So imagine you are kind of quadruped over over the board. So you have, your knee and hand on one side, knee and hand on the other, and you are trying to extend the right leg and the right arm at the same time. Go to full extension, come back and touch the knee to the elbow, and then return back to the quadruped position. This
Under
is looking
control.
Control being the key word. Yeah. So this is looking to test like core stability and control, coordination and balance, and then symmetry between right and left sides. The common issues here are going to be trunk rotation or loss of alignment, poor core stability, and inability to maintain balance. And like I said, this is one of those where we probably have like a 20% success rate, and it's mostly women.
Yep. Yeah. Total. I've seen the same. Yeah, for sure.
Yeah.
Okay. So that is 7 tests, right? On the FMS. Do you do all 7? Or I think you said you don't, because the active straight leg raise has already been done on the table.
That's the only one that we really skip. Yeah. Okay. And they have since, so FMS has evolved. They have since added some additional tests. Because of the other things that we're already doing, we don't include them because we feel like we have the information we need from those 7 tests.
Sure. How long does this take?
So table screening plus FMS, barring any sort of, issues that are identified right out of the gate, we can get this screening done in less than 20 minutes.
Awesome. And you keep the records of this. How often do you retest this?
Well, so we go into the assessment phase, which is next. It depends on what we found as part of the FMS screening and the table screening. If they were limited 1 or limited 2 in the table screening, or if there were any glaring disparities in strength, mobility, stability, or weakness in the FMS screening, then those are identifiable as like, these are worth retesting. If they pass with flying colors, barring any sort of injury or setback, like we don't have any need to retest.
Makes sense.
But what we do from here is based on how they perform during these, the table screening and the FMS screening, we then take them through a handful of assessments. We use most of the time, unless it's an athlete coming to us for a very specific purpose, we use a lot of the level method based assessments.
Yep.
The goal is really to choose things that anyone that walks off the street can do, and to gather a pretty well-rounded picture of their fitness starting point across the board. So in other words, we want to look at something that's going to test their aerobic system. We want to look at something that's going to test strength for upper and lower body. We're not super, glued on having to test like anything that requires like a high level of skill set. So we want to find things that are low skill, but give us like a good picture of just like a baseline of the different, areas of fitness that we want to look at.
Yeah. Okay, cool. And I think that's what hopefully most coaches, most gyms are doing, that latter part. Maybe not like to the degree of understanding a baseline. Like I think that's where I see it get messed up, is people just do it as an introduction to certain movements, but not necessarily measuring it as a baseline.
You know what I mean? The difficulty is just unnecessary complexity. Like you want to strip away complexity so that it makes it measurable and repeatable. For the next time that you want to retest these baselines. So like a good example of this is like doing a 10 or 15 or 20-minute row for calories, obviously depending on the skill level or the, I should say like the starting fitness of that person. Like you may have somebody that can't row for 10 minutes straight, in which case you could just do 5. But the point is like when you're testing aerobic power, like that's a pretty good indicator for that individual.
Yeah, and I think showing people progress is so much of the importance of what we're doing, right? Like to be able to say, hey, like I can't tell you how many people before I started doing reliable retests on things where they'd be like, yeah, I remember when I started, I was probably using like an empty bar and now I'm doing this. I'm like to have the data now is so much more helpful to helping them stay adherent and continue down what's really a long process. So again, I think the point is just like the assessment of their basic fitness is so important.
Yeah, and I think it's important to note that the table screening and the FMS screening for us, we do regardless of goal. So if you come to us and you say like, I want to compete in a natural bodybuilding show next year, we're still going to do that because those limitations will ultimately be things that help us decide how we're going to go about writing your programming and how we're going to have to work around your current limitations and how we're going to fix them over time. And that goal would apply if it was grandma who just wants to be able to walk on her Italy trip next year without knee pain. So it's all the same.
Do you find that it's challenging for people to understand the decisions that need to be made after this screening, or do you feel like through the screening they can make better? Like what I'm trying to get at is I think I want to keep honing in on the simplicity of this, so that it's like by doing the test, you will probably understand things that would be contraindicated to have them perform without a extensive background in physical therapy, right? Like, am I wrong there? Or do you feel like
no, you're 100% right. You do not need a PhD in exercise science to take the information that you learn, even if it's just visually through going through these screenings, to apply it to the way that you start with this individual. There's no coach on the planet that is going to take somebody who, experienced knee pain during the deep squats test and couldn't keep their arms locked out overhead, who is going to be like, okay, day one, we're overhead squatting. Yeah, like, you know what I mean?
Well,
Like,
I am. Yeah.
right. Like you can barely understand all these concepts, and purely just by watching someone go through that screening, you know, hey, like overhead squatting is probably not the best starting point for this individual.
Yeah. And then in terms of restoration or improvement of these tests, like how much education does somebody need to be able to do that? Or is that, you know what I mean? Like how
I
does that
mean,
happen?
I think as a coach, everyone has a level of responsibility to learn the basics of anatomy, physiology, biomechanics, program design. Um, like it, these things are free and accessible for everyone. Does it mean
Mhm.
that you need to inundate yourself with it on a daily basis and become obsessive? No, because I also think there are plenty of people out there that have master's degrees in exercise science who do a really poor job of programming for clients anyway. But it can't hurt to just continually educate yourself in these areas.
Yeah, and even reverting back to the relationship with the physical therapist there too, to say, hey, this is what I'm observing. Like, what is within my capability to try and assist this person with? Like, I think that would again really just refine and deepen that relationship on a basis that would just grant
Yeah,
more
and I
access to
think
that continuum.
back to what we originally said, like the goal is not to restrict movement per se. The goal is to find the best starting point and the best use of time with the client. And I think a concept that you can work with off of these screenings is if there was limited range of motion, right? Whether that was whether that came with pain or discomfort or it didn't, your number one goal is to figure out how do I give this person exercises that help them over time improve their ability to get into these ranges and demonstrate strength and stability in these ranges. So it's like right there. If you have glaring weaknesses, let's say that it's the hip flexion test. And it's like, okay, cool. Like this person's hamstrings are weak and they are short. It's like, cool. Like there are a bunch of Romanian deadlift variations and things that you can do with light loading that can help uh, get this person to have the greater ability to hinge at the hip
Yep.
while stabilizing their spine. And it's like, I don't know that there's a better thing you can do for somebody in terms of like hip and back health than improve in those areas if they show limitation.
Yeah, that's awesome. And how one of the things we talked about when we started was like you're not taking barbells away from people just unnecessarily. And I think that that's something that coaches have a very hard time with is the appropriate modifications for people that they are aware of but don't have any data behind. And by I don't think that was very well explained, but a common one was kipping pull-ups, right? You shouldn't be able to you shouldn't do kipping pull-ups unless you could do blank number of strict pull-ups. And I think that's a fine starting point. But I think clients, when I've had issues with that in the past, they really wanted to know why. When I can talk somebody off the ledge if they're trying to do kipping pull-ups, they can't do strict pull-ups. And I say, hey, you really like let's work on your requisite strength here in order to strengthen those tissues and prevent your injuries from in the long term. Like they are way more bought in than just saying you can't do 3 strict pull-ups, so you're not allowed to do kipping pull-ups. And again, that's a really specific example, but across the board on all of these things, like the overhead squat test, in terms of going, snatching a barbell, like there's going to be some limitations there that you can then convey to that client to say, hey, remember, like you were, not, that was not super awesome. Like you can imagine not forcefully throwing a barbell over your head and potentially behind your head, how that could be problematic. Right. And I think that they just have so much more buy-in with more data and more education and more reasons to help assist them on their journey.
Yeah, I actually have an example of this that just occurred at my facility a couple weeks ago. So I think the education piece is huge. Like being able to explain to people why this is going to make them better in the long haul at the thing that they're wanting to improve upon. And when I say it's going to get better in the long haul, I'm also saying it's the most effective path to getting you where you want to go.
Yeah.
Right? We had somebody who's been trying with pull-ups for the longest time, and they would do a bunch of eccentrics and it would bother their elbows. We tried, to have them do standing pull-ups where they're basically trying to, assist themselves as much as possible. We're fortunate in my facility to have a cable machine with a lat pull down. And I was like, hey, like, you're going to come with me. And I gave this person sets of like 10 to 15 lat pull downs where they were doing like a 3-second eccentric, a 2-second hold in this elongated position for the lats and having to pull back down to below the chin. And the thing is like, if I left them to their own devices, they would just like crank away at this thing. Right. And they'd be like, all right, like I feel corny. I'm like sitting on this machine. I'm not over there where everyone else is on the pull up rig. This is boring. But what I did was I stayed with them.
Yeah.
Right? And this brings me to my second point, which is that you can get people to do the quote unquote boring stuff if you keep them engaged and you challenge them. So I stayed there and I was like, no, like you're going to stay with the tempo. So I'm like counting as this person's, raising the lat pull down all the way up. I'm making them reach all the way to the ceiling so that, their traps are elevated and their scapulas are slightly winged out. And it's like, then they're retracting their scapulas and initiating the next pull. And it's like, by the time they're in like maximal effort of 12 to 15 reps, like they are on fire in a way they have never felt their lats and upper back. And like the bell goes off where it's like, I haven't felt my back like that ever.
Yeah.
And like, so my point is that it's both the education piece, but it's also being there to ensure that the stimulus and that the intensity is where it needs to be so that the person feels it where they're supposed to feel it. And that connection often happens when you're able to do that.
Yeah, that's awesome. I love the success stories. It really refines like when you see it work, like, oh yeah, this is why I'm doing all these things. Okay. Where would somebody start? Like, I know I think we did a pretty good job of overview on how you do it. If a coach wants to start implementing this with their clients, like how would they start doing this?
I mean, I think the easiest thing is, we leveraged screenings that were already out there. They were already proven. So you can do something like FMS. I want to say it's like less than a couple $100 for the initial test. And I think you pay $100 a year just to have access to the software.
And I think it's all on YouTube anyways. I mean, not to take, I think the certification is great, but if you want to just understand further what we're talking about, like I think most of this stuff is very accessible. So
yeah. And start with like a minimalist approach, like even if you have 4 screenings, it's better than having 0.
Yeah.
I think simplifying this and finding a way to just get a snapshot of movement, throughout the whole body, the best that you can, is a great starting point.
Yeah. Love it. All right, man. Well, let's wrap this up. And I think that the point you just finished with is a great one to end on. And I think that just beginning with a screening is going to help your clients succeed in the long term, help you make better decisions, help keep people out of injury, establish better relationships with your professionals in the on that continuum we referred to. It's just going to be better overall. So dive into that stuff and start to implement it.
Yeah, I mean, if people never get tired of results, and if this is something you haven't been implementing, it's a great opportunity for you to go back and implement it with your clients and explain to them that this is going to help you just make better decisions with their programming, and then just start incorporating it with every new person that you work with.
Love it. Thanks, Derek. Always a pleasure.
It was fun, Kenny.
Talk to you soon.